Sterile compounding. Background. Most parenteral formulas must be sterile, meaning the formulation is free from microorganisms. Sterilization applies to all injectable formulations, ophthalmic formulations, inhalation formulations, nasal aerosol formulations. Parenteral products have special requirements for how they are prepared, packaged, and administered. These formulations must be sterile because they have rapid access to the circulatory system and can cause great harm. Compounding regulations. Compounding provides for patient care in multiple settings, develops chemical and medical processes and protocols to provide safe medications for patients. Compounding regulations, standards, and guidelines involve the work of many organizations, boards, and agencies at both federal and state levels. There are two primary regulators in compounding. 1. Food and Drug Administration. 2. Individual state boards of pharmacy. The United States Pharmacopoeia and National Formulary, USP&F, has been the predominant organization setting sterile compounding standards. Chapter 797, Sterile Compounding Standards. Compounders' responsibilities. Compounding personnel are skilled to correctly perform and document the following activities. Perform antiseptic can cleaning. Select and appropriately don protective garb. Perform disinfection on non-sterile compounding surfaces. Maintain or achieve sterility of compounded sterile preparation or CSPs and ISO Class 5 devices and protect personnel and compounding environments from contamination. Manipulate sterile products aseptically. Label and quality inspect CSPs. Special solutions. Total parenteral nutrition. Complex admixtures used to provide nutritional support to patients unable to take in adequate nutrients through their digestive tract. The admixtures are composed of fats, dextrose, protein, electrolytes, vitamins, and trace elements. Dialysis solutions. Another type of parenteral solution, irrigation solutions. Not administered directly into the venous system, but are subject to the same stringent controls as IV fluids. They're packaged in containers that are larger than 1,000 milliliters capacity and are designed to empty rapidly. Administration devices. Administration sets. IV control chambers. Volume control chambers. Syringe pumps. Piggybacks, which is the mini bag container, and it's placed higher than the large volume parenteral LVP solution container, forming a Y, so they call it the Y site. The piggybacks function are small volume solutions connected to an LVP. They administer medications intermittently in small volumes at the same time intervals. Sterile compounding entails various amounts of equipment. Due to some patients receiving home infusions and home treatment. Primary engineering controls. Primary engineering controls are devices used to provide a classified air environment. Per USP 797 definition, it's a device or room that provides appropriate air quality when compounding sterile preparations. The ISO air qualities are based off the number of particles. Example, ISO Class 3, particle count 35.2. ISO Class 4, particle count 352. ISO Class 5, particle count 3,520. Laminar airflow workstations have horizontal or vertical airflow. This is where you perform your sterile compounding work, staying 6 inches within the hood and not blocking the airflow. Blocking the airflow will cause turbulence and contamination. Microorganisms that are invisible to the eye are present on dust and particulate matter in the air, as well as on most surfaces, even those that appear clean. Aseptic techniques. Garbing. Remove all jewelry, hair bonnet, shoe covers, mask, put on gown, and secure tie strings. Wash hands. One of the many ways to minimize contamination is to properly wash hands. Put on sterile gloves. After you put on your gloves, spray your gloves with isopropyl 70% alcohol to lock in sterility. Clean everything you will be using in the lab. Mop floors. Move everything back in and begin compounding. Aseptic techniques are necessary because just being in a sterile compounding lab doesn't guarantee a sterile compounded preparation. Before you begin compounding, you want to place all supplies in the hood in agreement with the airflow. Working in a horizontal laminar airflow workbench, LAFW, smaller items should be placed close to the HEPA filter and larger items closer to the opening of the workstation. Hand movements should not disturb the airflow pattern. Working in a vertical LAFW or direct compounding area, DCA, place larger containers toward the back of the work area. Remember not to block the workflow from above. Working with vials. There are two types of parenteral vials that are used in making admixtures. One contains the drug already in the solution, the other contains a powder that must be dissolved in a diluent to make a solution. Coring. When a needle damages the rubber closure of a parenteral container, causing fragments of the closure to fall into the container and contaminate its contents. Ampules. Sealed containers with an elongated neck that must be snapped off before use. Syringes. Slip-tip syringes use friction to hold the needle on the syringe. The needle is reasonably secure, but it may slip off if not properly attached or if considerable pressure is used. Lure lock tip syringes have a collar with grooves that lock the needle in place. Eccentric tip syringes are off-center and used when the needle must be parallel to the plane of injection, such as in an intradermal injection. Oral syringes, used to administer liquids by routes other than parenteral administration. Sizes range from 1 to 60 milliliters. Needles, parts, hub, shaft, bevel. Lengths range from 3/8 inch to 3.5 inch. Needle-free devices. Some needle-free devices can inject preparations intradermally, subcutaneously, or intramuscularly. When compared with needle and syringe injection methods, needle-free devices offer multiple benefits. Less painful, enhanced compliance, reduce risks such as needle stick injuries and cross-contamination, eliminate the need for sharp disposal procedures, and provide a reliable, reproducible, and accurate delivery of medication. A needle-free valve has been developed that allows the connection of administration sets at a Y site or smart site. Filters, used to remove particulate materials or microorganisms from solutions. Depths filter work by trapping particles as solutions move through twisting channels. Membrane filters consist of many small pores of a uniform size that retain particles larger than the pores. Final filters filter the solution immediately before it enters the patient's vein. Filters also can be placed inside of needles. These are called filter needles. Final inspection. When CSP is completed, all additive containers and syringes used in the compounding process should remain available for inspection and final check. Inspection verifies that the physical appearance of the CSP is as it should be. The compounder must also check that the CSP and its labeling match the prescription or medication order. Waste disposal. Once a parenteral solution has been prepared and inspected, any used syringes, bottles, vials, or other supplies should be disposed of in properly labeled sharps containers. The Environmental Protection Agency, EPA, through the Resource Conservation Recovery Act, RCRA, has the authority to regulate handling of hazardous wastes from their generation through their disposal. P lists wastes: chemotherapy drugs, warfarin, nicotine, and physostigmine. U lists wastes. Example: cyclophosphamide are toxic, flammable, corrosive, or reactive and are hazardous even in trace amounts. To prevent microbial contamination, thorough cleaning and disinfection must be done. Quality assurance. USP/NF 797 standards require every parenteral compounding facility to have a formal quality assurance QA program. A QA program is a series of steps designed to assure compounded preparations will be safe, stable, and of the proper identity, strength, purity, and quality. Should be conducted after compounding preparations have been completed. Must include both active and passive documentation for each compounded CSP. Parenteral incapabilities. Not all drugs are compatible in solution with each other. An incompatibility may exist between two or more drugs or between a drug and a base IV solution. Some incompatibilities, such as color change or hazy appearance, can be seen. Other incompatibilities may not be indicated by color change, precipitation, or gas formation. Factors affecting compatibility and stability: pH, light, temperature, dilution, buffer capacity, time, filters, solutions, chemical complexation, plastics. Units of measurement: molarity, an expression of the number of moles of a drug in a volume of solution. Moles per liter equals molarity. A mole is the number of grams numerically equal to the molecular weight of the drug. Molecular weight, the sum of the atomic weights of all the atoms that make up the drug molecule. An osmole is equal to the molecular weight of the drug divided by the number of ions formed when a drug dissolves in solution. Equivalent weight, a drug's molecular weight divided by its valence. Valence, the number of positive or negative charges on an ion. Percentage weight or volume, the drug's weight per 100 milliliters of the drug in a solid, or the drug's volume per 100 milliliters if the drug is liquid. Copyright 2019, all rights reserved, the Capstone Institute.